medicine is difficult. And being a young Black female physician with my personality can be very difficult at times too. Voicing those needs to elected officials in our communities, making sure that we're voting in all elections. There's all this hype right now about the upcoming presidential election. We as Americans do have a history, even if it was in small areas of the country, working together despite differences.
Welcome back to the Marian Flaxman Network Podcast, a podcast dedicated to reintroducing personal narratives into critical public health topics. On today's episode, my conversation with Dr. Janel Gordon. Dr. Gordon is a practicing family medicine physician, and she's also the medical expert for Wish TV in Indianapolis, Indiana. Dr. Gordon always knew she wanted to be a doctor, but after going to medical school around halfway through, she decided that family medicine would be her specialty. She then went on to get board certified in obesity medicine as well as lifestyle medicine, and she's now a passionate advocate for culinary medicine, or food as medicine. In this conversation, we talk about the many struggles that come along with trying to integrate food as medicine and lifestyle medicine into a basic Western medical practice. We also talk about the role that community, family, and policy support can play in supporting individual and overall wellness. Finally, Dr. Gordon shares her own ups and downs in the kitchen and how she's learned by experimenting with different recipes. Please enjoy my conversation with Dr. Janel Gordon. Janel, Dr. Gordon, welcome to the podcast.
Hi, Marian. Thank you for having me.
I'm so excited to have you here. So I first of all want to just jump into a time machine and take us back to early life, little Janel. What did she think she wanted to be when she grew up?
Ooh, so little Janelle always knew that she wanted to be a doctor. And from time to time, I would think about other careers. Interesting fun fact, at one point I thought, oh, maybe I'll be an opera singer. I'm not sure where that came from. I did play the violin starting in elementary school. I really don't play it now, though I do still have it in my home. But I always knew that I wanted to be a physician. And more specifically, I thought that I wanted to be an anesthesiologist. My fifth grade autobiography that we had to do for a class even states that I was going to be a physician. And I drew a terrible picture of a syringe at that time.
That is so awesome. And do you know, looking back, what was it that gave you that instinct that you wanted to be a doctor?
I think a lot of kids grow up saying, oh, I want to be a doctor. You know, a lot of toys that we introduce to children. Children may have a play stethoscope or a teddy bear that they're taking care of. And sometimes kids play house, or it even goes beyond that where they're taking care of them because they've experienced being sick and their parents taking care of them. And I remember one time we were at a family function, I overheard someone talking about anesthesiology. And it kind of piqued my interest. I was still very young at the time, but my mother was a stickler for reading. If we didn't know something, we had to go look it up in the encyclopedia. We were always going to the library to look at books. And I knew that I liked helping people. I'm a loving person, an empathic person, and I also like solving problems. So medicine just seemed like the right fit, even at that young age.
Yeah, absolutely. And so did you maintain your interest in anesthesiology, or when you went off to college or medical school, how did the path shift?
Yes, so my senior year, my junior and senior year of high school, I took two classes. They're called health careers. It was at the local career center for my school district. And we had to do sort of like a co-op or internship as a part of our senior project. And I actually shadowed 5 anesthesiologists at one of the major hospitals here in Indianapolis, Indiana. And my interest was piqued further into obstetric anesthesia. So I've always known that I wanted to relieve suffering. That's what most of us in medicine have an interest in, a passion in, and more specifically, like pain. And I thought, what better way to do it than in the operating suite, working alongside the surgeons and the rest of the surgical team to help put a person to sleep so that when they wake up, they don't feel the pain at all. When I went off to college in North Carolina at Winston-Salem State University, I was actually at an event with Wake Forest University and Winston-Salem State University students and staff, and was introduced to someone who had a friend who was actually a pain medicine physician in Winston-Salem, North Carolina, and actually shadowed him. And I thought going into medical school that I would do pain medicine. Continued to shadow pain medicine doctors when I was in med school. But somewhere I say like at the halfway point of med school, I started being even more interested in social issues and how I could affect change from a physician standpoint and not just like volunteering or serving in the community. And that's what led me to primary care.
That's really awesome. And it's such a
Mhm.
pivot because I feel like primary care is this very sort of comprehensive, all parts of you is working with all parts of the patient. And anesthesiology is very acute, right? You're sort of containing the pain in this moment during their surgery. So it's quite the pivot. But I like hearing you say that you were interested in relieving pain and suffering. And then you saw how, when you zoomed out a little bit, there were
Mhm.
these social issues that maybe were contributing to pain and suffering in a way that you couldn't quite solve at that super zoomed in, pain resolution in the moment level.
Yes, exactly. That's exactly what it was. And being a family medicine physician gave me the option to not just see adult patients, not just to see children, not just to work with pregnant women, but to see the entire family. Because I may see an adult patient, but what influence does their partner have on them, or the children that they have to take care of and the foods that they like to eat? I may see a child, but they're in the care of the parents. So really, it's not on them to be able to make certain changes in their lifestyle for better health and overall wellness. So choosing primary care was definitely the fit for me.
Yeah. And it sounds like there's a lot of questions I want to ask you about public health that we'll get to later, but we're already kind of touching on that, which is that, when you see one person, no one person exists in isolation. And the more that physicians can get to know about their patient, the better equipped they are to help them. So my guess is that we're seeing a lot of patients, a lot of families, and you begin to what, like see how their lifestyle is playing a role in their diseases? Like, how did your interests begin to tiptoe towards food as medicine, culinary medicine, lifestyle medicine?
Sure. So I'd say that interest was even there as a young person. So my mother had us very involved in the community growing up. I was in Girl Scouts. I was in a sorority in high school called Tri High Y. We were very involved in our church, and I saw a lot of members of the community in my own family who were affected by many chronic disease, many of which I'm sure you're familiar with, your family may even have, and people who you know. So high blood pressure, diabetes, high cholesterol, obesity. And I saw how poor stress management, um, lack of access to nutritious foods, great transportation to even get those foods could affect the health and wellness of a person. I saw that even in high school without the breadth of medical knowledge that I have today. But that continued to be fueled with my involvement in the Student National Medical Association and medical school. And even as I became a resident working in Baltimore with the community, with the citizens of that community, and seeing how they would have to take multiple buses just to get food for their family, or how far they had to travel just to get great child care for their family, and how not having that could affect them in the long run when it relates to chronic disease and weight.
Yeah, yeah, of course. And so I do want to talk a little bit about obesity because it's something that you specialize in as a physician, and it's something I've experienced personally. I was overweight and obese when I was a kid, and then, changed a couple of things in my diet and lifestyle, and everything changed for me. I no longer I don't identify as someone who is obese but is battling against that, or is watching their weight. Like, I haven't watched my weight since maybe I was like 15, right? And I
Mhm.
was watching it very closely at the age of 15. But
Mhm.
since then, it's been a non-issue for me. I've had 3 pregnancies. I've, gained and lost 40 pounds with each one, and it was totally fine and effortless because of these sort of basic sustainable changes that I made to my life and diet based on a sort of holistic understanding of the factors that cause overweight and obesity. So I'm curious, from your perspective, obviously, you mentioned your own community, your own family, and then, of course, your patients. What have you learned about the many factors that impact obesity that you feel like maybe the average person doesn't know or understand?
Yes, so obesity is a very complex disease. And I want to be sure that your listeners, I know you're aware, know that that's exactly what it is a disease. We typically just say, oh, just you need to eat less, you need to move more, but it's not always that simple. There are many factors that can play into it. For some individuals it could be a genetic issue. For others it could be hormonal. We know that there are a lot of changes that occur in a woman's body during pregnancy and even after. We know that there's a lot of talk right now about menopause because we haven't had as much research in that area and not great treatment options, or treatment options that were considered to be taboo because of possible side effects. So all of that can affect a person's weight. And I've seen that firsthand in working with patients. But we also cannot discredit that food is a major component of it, and as is physical activity, restful sleep, and stress management. And so all along I knew that I had an interest in weight. I actually thought at one point it would be more on the child focus, so pediatric obesity, because at one point I was considering just peds, and again I realized I needed to care for the whole family. But we do know that not just nutrition and physical activity, stress management, but even your mood can affect it, and how all of those factors in a parent can affect that in a child. And so then it's no surprise why you see some of these chronic diseases running through the family. So here I am treating individual diseases for patients, giving them a medicine that may not work. I have to go up on the dose or change the frequency. Then they may have a side effect. I have to give them another medicine. And I have all these tools. I know that I was very well trained at the University of Maryland Family Medicine Residency Program, but I still felt like I wasn't adequately able to help patients. And so from there, I decided to dive deeper into getting my certification in obesity and opening up myself to the knowledge and how to properly use medications, or knowing when to refer patients to specialists who have more training than myself.
Absolutely. So, sort of jumping off from that, what are your thoughts on the new, very trendy, very popular GLP-1 agonist drugs? And what, if any, role do you think that they can play in combination with diet change? Because I think that people hear GLP-1 and they think, oh, this is like a magic bullet. And now we're not going to even talk about diet change. But I feel like the real potential is when they work together, no?
Yes, so I think we have to look at it on a case by case basis. There is no miracle anything. Most people will do better with a combination of treatment, but if there was such a miracle, the GLP-1 agonists are great medications. Now, there are side effects that a patient could possibly experience, but that's with any medication or even procedure that a person may decide to take or have. However, I do feel that not every patient is going to make such lifestyle changes, and not because the desire is not there. They may not have the mental bandwidth, they may feel like the resources aren't there, and we can work with patients through that. But to think that every patient is just going to change how they eat and start running all over the place every day and all of a sudden get their weight down and keep it down to a healthy state is unrealistic. We have to be realistic. I've worked with patients from all walks of life. I do feel that these medications work best in combination with changes in nutrition if a patient doesn't have the most healthful nutrition, and also with changes in physical activity, proper stress management, and getting adequate sleep. All of those can affect a person's weight.
Yeah, absolutely. And I think the sleep piece, I know in my own life, that's something that after 3 kids and many years of no sleep, it's suddenly not in weight, but in other ways. I just was feeling run down and I was kind of like, I eat really well, I exercise, like what's the big deal? And then it kind of hit me that I was only sleeping 5 to 6 hours a night maybe for more than a decade. And of course, that catches up with you. So even like it's so important to reinforce that all of it works together, like diet change, lifestyle changes, physical activity, and sleep, because really you can have 3 out of 5 or 4 out of 5 going really well, but that last piece might be the thing that's standing in your way of feeling your best.
For sure. Sleep, definitely. And why a person is not getting adequate sleep. Again, is it a hormonal issue? Is it stress, mental health? What is it that could be causing that to happen? But studies do show that that will affect someone's weight, and not just their ability to lose weight, but then to keep that weight off.
Right. And it totally makes sense just thinking about all of the stress hormones that our body produces to try to keep us upright when we're sleep deprived. Those are not hormones where the body wants to release wait, those are hormones that make us want to hang on to things just in case things get really, really bad and we have to run from a tiger. It totally makes sense that those hormones would interrupt a healthy shedding of excess weight.
Exactly. That's exactly what it is.
So I feel like, I had my own experience with weight loss and it was very I'm going to say unique. It was unique because I was quite overweight, but also like my tummy hurt every day. And so I had a
Mhm.
doctor who said, "Well, why don't you try cutting out dairy?" So I said, "Oh, okay, fine." And the only thing I did really was cut out dairy. I wasn't exercising, I wasn't counting calories. I was 14 years old, so my body was very malleable, right? Very fresh and ready to try new things. But when I cut out dairy, I lost like 60 pounds in 2 months doing nothing else. And for me, it was this immediate lesson of like, okay, so the weight loss story is not as simple as you hear it. Because prior to that, as an overweight teenager, I had thought the only way that I'm going to lose weight is by starvation and suffering. I'm going to have to
Mm.
calorie count and force myself to work out 2 hours a day and just work for every pound, like fight with each pound to get it off. And when you're staring down, 60, 70 pounds of weight loss, that's a long fight. And so it was very discouraging while I was overweight to contemplate that. And then I'd make this one dietary change to resolve my stomach issues, which it did. And the accidental benefit was that I dropped 60 pounds almost overnight. So I'm curious to hear, have you seen sort of aha moments like that for patients where there was like this linchpin that was just in their way? And it wasn't so much, oh, they're not trimming their calories tight enough or they're not, walking 12,000 steps a day often enough. Like, have you seen these kind of individual unique things where one person's body is just stuck on this weight because some specific thing is in their way?
Sure. So again, for many individuals, it can be multifactorial, but for some patients, they may change one thing and notice great changes in their health. That could be their weight, that could be their skin, that could be even stress for them. So I know I had a colleague one time, and you think, okay, we know sugary beverages, calories, et cetera, it could cause you to gain weight. But there are some individuals who may be considered normal weight according to the BMI, which we don't use that in isolation. We know now that the World Health Organization says that it should be used in combination with other measures of health. However, that's what we used historically for a very long time. So normal weight, but they're like down in the cokes. And so you may have another person who they may carry more weight on their frame. And we also see that they drink a lot of sugary beverages. But I had a colleague one time who drank Pepsi religiously. And this individual did carry more weight on their frame. They cut that out and dropped weight like 60 pounds within a year
Wow.
just from cutting out those sugary beverages. For some individuals, it could be dairy, and not just for weight, but some other comorbidities that go along with having excess weight, like being overweight or having obesity. So, some individuals may suffer from reflux or have GERD. And you see, when they cut out some of these foods, all of a sudden they're feeling better. And their weight even may go down with that. Sometimes it's like, what came first? Did the GERD come first or did the weight come first? Since they can coincide with each other. So I have seen that. But for many of us, there could be various different factors that are leading to us having excess weight on our frame.
Yeah,
And some of these
definitely.
things could be coming from childhood, or like I said, even previous generations that we may not even realize are negatively affecting us in our health.
Right. And again, like just to kind of use my own story as a case study, my dad had been chubby when he was a kid, so I had this narrative in my head like, "Oh, like dad was chubby and I'm chubby, like it runs in the family." But
Mhm.
if you actually examine our individual childhoods, we both had a childhood history of antibiotic use and overuse. And so this like gut dysbiosis and then indigestion and then the excess weight. And so it's not as simple as like, because I have 3 kids and none of them are chubby, right? Like it's not genetic per se. It's like this unique combination of genes and story and lifestyle and inflammation and gut dysbiosis and how are all of those things playing a role. And for me, it was just that turning point was removing this one thing from my diet, which I think ultimately it wasn't so much the one thing, although that was huge, but it was the lesson that just one thing could make such a profound difference. And what if I paid attention to everything? right? If one
Mm,
thing can change that, then what if I did start working out and I did? And what if I ate more fruits and vegetables and I did? And what if this and what if that? And suddenly the whole world of healing was opening up to me. But it just began with
yes.
that one shift.
Yes, yes. So I agree. And that's a good way to phrase it. Like if you made changes just with dairy, if you started looking at other things that you were taking into your body, not just by your mouth, even like what are we feeding? What media are we listening to? Who do we have around us? And are they speaking positively in our life? And how can that affect us in our weight and our overall well being? A lot of that you can start to see, okay, we made those changes and look at what it did for us. Or maybe it didn't do that much, so let's go back to the drawing board and see where else we can make changes. Is there a point where we need to introduce medicines? Is there a point where we need to have you refer to someone else? Do we need to get you in with the trainer since you said you've been working out in the gym, but you're not seeing that needle move? So, do we need to order more testing to figure out are we missing here from the healthcare professional standpoint?
Right. And I love your perspective, and I totally agree that treating the whole family together is this unique opportunity to see how all these different factors play into the health journey. I'm curious, in your many years of working with patients and families, have you ever watched a parent learn something about their own health by going after the health of their children? Like, so they come to you because their child is sick, but then in pursuit of the child's health, they learn something about their own health.
Definitely. I had a patient who was dealing with weight issues. And as we were working with the child, the parents started looking at their own dietary choices and what foods they were bringing into the house. They started even looking at behind that what their mental state was and how that could have been affecting the child. And this is not to point fingers at anyone. Then they started examining their childhood and that how that it was playing into their child's upbringing. So and wellness. So it's a lot of deep diving. That's why this whole thing of 10 minutes seeing a patient is just unrealistic.
Well,
And
right. And
thankfully,
how do
in
you
primary,
handle that?
it's difficult. It's difficult. And that's why my career has been what it is. I've had a lot of experience in different settings because if I feel like I am not in a place where I can adequately take care of a patient, and I do not have the team to do that with, it has been voiced and changes are not being made, then I feel like, okay, where can I best serve individuals in my community? And so that has taken me to many different places. And all along the while, I feel like I am meeting individuals like you, I'm gaining skills and even improving my own wellness.
I love that North Star because I really
Mm,
do think that oftentimes as humans, as women, as people that want to do good, sometimes we feel like, well, maybe I'm supposed to stick it out and suffer. But
mm.
when you have this North Star, where it's not really about you, it's about how can I serve at the highest level? How can I help in the greatest capacity? When you see that that ability to serve is being stymied, you're like, no, have to pivot.
The queen of pivot. Crown.
Dang, I'm gonna wrestle you for that crown, but I think you've earned it. I think you've
It's
earned it.
hard to do though. It's hard to do, but we have so many of us in healthcare who we are not well ourselves. And let's just pause for a second because no one's perfect. And this is a continual process on this life journey. Like you're noticing, okay, here's an issue here. How do I work on it? Do I need to pivot? Do I stick it out? Like we're never going to have it all figured out, but we cannot discredit how this can affect our weight how and not just for ourselves but even our the generations to come after us and through us in our community. So there is a lot of examination that's been going on for me personally in the exam room with patients, with family, church members, friends, and even in terms of work that I'm able to do with others in the community.
Yeah, and so I am very curious. You've been doing this work and healing others and listening to others, and my own experience of being a person on this planet is that there's almost never a time that I help someone else that I don't learn something for myself as well. So I'm curious, from all of this work and all of this helping others, what has it given to you? What have you learned from your patients that you've then applied to your own life?
I've learned so much. So, as I stated, I always had an interest in weight and eventually got my certification in obesity medicine. But even from there, Marian, I still felt like something was missing. one time in my first job after residency, I moved back to my home state of Indiana, and I had a patient who had high cholesterol, and I wanted to put her on a statin. I mean, the studies show that patients do well and it's cardioprotective. So she said, Doc, please, I'd like to make some changes to my health. Like, can I do that before you put me on the medicine and then bring me back? And I thought, your body, like I'm not here to force anything on anyone. I'm just simply stating from my expertise what is going to be best for you. So we did that and I brought her back. And do you know that woman got her cholesterol down and she hands me this book about plant-based lifestyle and how not to die by Dr. Michael Greger. And I had never heard of this physician and literally changed my life. Like changed my life. From there, I've since received my certification in lifestyle medicine. I was able to focus on lifestyle medicine with individuals in my most recent in person clinical job. And that book actually was in every exam room at that practice. And so then I start looking at my own personal life. And like you said, you were noticing things in your body even at a young age. And I realized there were things I have been dealing with. And I started thinking, okay, if I start making tweaks here and there, and I talked to other physicians who had known me for many years, and they thought, well, maybe do this and go gluten, don't drink this, don't eat that. But as I started making changes, I started realizing how I started feeling better. And so I credit that patient. And those are some of the best days in clinic because this work is hard. Very hard. No matter what we do in life, like many industries, especially post pandemic, are going through changes, but medicine is difficult. And being a young Black female physician with my personality can be very difficult at times too. And then you're telling me that I want to take time and talk to patients and I don't want to just in and out every 10 minutes. Like it can be difficult. But when you have those patients who you thought you were helping them and then they tell you something and a light bulb goes off and it's like, wow, that's going to help me examine myself. And that could be your mood, that could be how you interact and communicate with others, that could be the foods that you're eating or how you're preparing certain things, family traditions. Not to say we just have to like revamp everything, but just to make you start thinking more and being more mindful. Patients help me all the time, asking a question, and then it takes me into a deep dive looking something up. And next thing you know, it's like, oh, wow. I didn't know as much as I thought I knew on this area. Or look, there have been more studies that have come out that not completely refutes what I thought, but it's causing me to look at it in a different way.
I just like literally got chills while you were saying that because I can feel how many women listening to this are like, "Oh my god, I wish that my doctor was like this. I wish that my doctor was listening to me and open to learning from me." Like, I know so many women who spend hours in
Mhm.
doctors asking questions, trying to get answers, and just kind of hear over and over like, "Ah, the research says this, like, go home and take that." And oftentimes, well-meaning doctors short on time who just are not open to being as curious and as flexible and to learning from the patient as it sounds like you are. So, yeah, just hearing you say that, I was like, wow, like where's the line to sign up to only have a doctor like you? Because it's so important to people on their healing journey to know that their care provider is listening. And a critical part of listening is that mental flexibility to go, like maybe I don't know as much about that as I thought I did, or I'm going to double check that and really, really hear you. And that's so powerful.
Yes, and my colleagues are great. I don't I don't want individuals to feel like, gosh, my doctor's terrible because we are products of our environment, our educations, and the systems in which we work. So we're speaking about nutrition. We know that for decades, not just physicians, but even nutritionists, nurses. One of my sister's a physical therapist, one's also a nurse, but we do not get the nutrition education that we need. Even when Congress said that it needed to be done and was mandated. It wasn't. It's just thrown in a biochemistry course during your first, second year of med school, and you're hopefully going to remember these things. That's not helping us take care of patients. So I don't want individuals to say, oh my God, my doc is terrible. I always say, because I've been there where I thought, well, no, the data says this. And I'm not laughing at the patient. I'm laughing now as I'm talking to you, but I'm like, no, this is what the data states. And they're saying, but doc, this is what I'm telling you. I'm like, okay, I hear you, but our minds just made up. I've been there before and I may be there again. So I ask patients, I put it back on them like, this is your health, this is your wellness, or that of your child's, your parent, if you're a caregiver, whoever you're taking care of and coming into the visit with. Please let us know respectfully if you feel like we're not getting it, or I'm not hearing you correctly, or you need to know more. I didn't fully answer your questions. Let us know, because if you don't, then we may leave the visit thinking everything's okay. Or patients will just say, that's it, I'm firing my doctor. I'm never going to see them again. And how do we make the system better if we have that attitude?
Right. And I'm not a doctor, but I'm thinking as a mom, my ability to give a compassionate response to my children is highly correlated with how much time I have to give that response. So, if we're in the car, we're in a rush, I have 5 minutes, I'm not going to give the same thoughtful response to a difficult question that I might give over a long, slow Sunday night dinner, right? So, when we're talking about the systems that are at play and who's being challenged by these systems, of course, the patient and the healthcare system is very challenged, but so
Mhm.
is the physician. You have 5 to 10 minutes, and a patient comes to you and says, I have 3 comorbid issues, and I'm
Mhm.
experiencing this, and I haven't slept, and my marriage is falling apart. And how are you possibly going to address that on billable 10 minutes time?
No, that's literally my day. Like sometimes when I talk to my family who isn't in medicine, they'll say, "Oh, wow, the patient talked to you about that?" Or really? And it's like, you would be surprised what happens within the four walls of an exam room. I mean, every day my patients are crying because I feel like myself and my team, we try to create the space for patients to feel vulnerable and comfortable where they can share us so that we can properly help them. And that's exactly what it is. Now, thankfully, again, primary care, I can bring you back, but then patients are like, bring me back. Like I took off time. Like I had to find somebody to pick up my child. I had to take a bus or the metro to get here. And you can't answer all these questions right now. And it's like, did you come here with these questions that just happened right now? No, this some of this stuff was years in the making. And it's like we can follow back up. And thankfully, coming out of the pandemic, we had telemedicine, and who knows what the future of that holds. There are a lot of people fighting for it, but we have that as an option, or patient messaging. But then that's also time on the physician and the nurses and the team standpoint, where that's extra time that could be taken away from that person who's sitting in the exam room waiting to be seen. So if we can all just try to be a little more understanding and graceful, I think it'd go a long way. And when I say that, I'm talking to myself also,
A
because we
hundred
forget we're
percent.
just in the hustle and bustle of this society in which we've created.
Yeah, yeah, absolutely. So, speaking of all of those factors and the complex problems, and even when you're best intentioned and have ideas on how to solve them, it's still challenging. Let's talk about food as medicine or culinary medicine. You and I met at the Culinary Medicine Conference, sharing a love of using food to heal and exploring different ways of cooking and enjoying food and talking about food. So, we're both passionate about food as medicine. But as a family practitioner, I'm sure that you see often that changing one person's diet is not that easy. And even someone who's motivated and even someone who likes to cook, which I feel like is a smaller and smaller fraction of the population, it's
Yes.
it's hard and it's not as simple and as quick as writing a prescription for a pill they can just easily, chug down with their morning coffee. So I would love to hear you speak about food as medicine, all the joys, and how exciting it is, but also where do you see the biggest challenges and where do you think more attention needs to be paid in order to overcome those challenges and successfully move food as medicine as a healing modality forward?
Well, that's good, and a lot of talking points there. So even with all my training, even within lifestyle medicine, I still realized I needed more. So there's a lot of talk about the Mediterranean diet, and the studies have shown how beneficial that could be for our overall well-being and even helping individuals with various chronic diseases. But that's not the only diet or way of eating that can be helpful. So we're in America. This is a melting pot, and we have individuals from various countries and ethnic backgrounds who historically in their families have cooked a certain way and honestly didn't have some of these chronic diseases. They may have had acute communicable infections, but they didn't have a lot of these lifestyle influenced chronic diseases until their family got to America. And a lot of that is from the ultra processed foods that we intake. And again, it's not like pointing fingers at all these people. We had society that grew. We have all these people that we need to feed, and how do we feed them? We mass produce food, and how do we do that? We may be inserting some chemicals, which we now know are not good for us, right? And trying to fight that battle there, but working with individual patients and say, hey, let's look at these traditions or these recipes that your family's always consumed, and how can we make some tweaks here and there to make them more helpful? And how can we work together without me just saying, don't eat this, eat that? That doesn't work for people. Or I may tell them that, but like I said, their partner may want to eat a certain way. And so there's a tug of war there, or with the children. And so it takes time to change a person's mindset. A patient, oh, I can't afford to eat that way. I can't afford to buy organic. I can't afford to not get something that's not packaged in a ready-made meal. Okay, if you're telling me that, now I have to work with you within that. So tell me, what is your go-to brand? And I'm going to take some minutes within my exam visit to get on the computer, show the screen to you, and say, okay, this is your go-to brand. And you like to shop at Kroger. I'm in Indianapolis, we have Kroger. Okay, what are the other brands in that aisle that you could go to for that particular food that you like? And what I would like for you to do is turn that package around. How many ingredients are on the list? What's the first ingredient? And this takes time. I'm not going to say you're going to be able to do all this and do it like that when you first start out, but as you get accustomed to it, it will become easier. You have high blood pressure. Let's look at the sodium content. How much is in there? Now, I could say, Marian, it would be better if they just made the meal on their own. And we hopefully can work them towards that. But we need convenience in this lifestyle, right? Depending on how some of us work and how many members in our family we have, what extracurricular activities they're involved in. I have friends who have had sick parents. My own mother had a stroke 3 years ago. And so a lot of people need convenience. So, how do we work within that? And I do think, even from a public health standpoint and even the government standpoint, there has been a lot of work since the conference on hunger, health, and nutrition in the Biden administration that hadn't been held for almost 50 years or 50 years, in terms of pushing food as medicine. So we've been able to get more work as it relates to meals for seniors that can accommodate different ways of eating, including more plant forward meals. WIC has been making a lot of changes as it relates to having more plant based milks available, even getting fish on there. And so I came through this, full disclosure for your listeners, I am plant-based, okay? But I know that all of my patients may not want to be plant-based. They may not understand the benefits or the importance. So it's on me to hopefully get them to at least be more plant forward. Because as you know, most Americans are not getting enough fiber. And that's even those of us who proclaim to be vegan. Why? Because so many of us are eating a lot of ultra processed foods.
Yeah, the fiber content in the average diet is so disturbingly low, but it's something that if you're not looking for it, and most people don't even know to look for it, you
Mhm.
won't notice it because fiber is satisfying and filling and soothes digestion in certain ways. But if you've never experienced that, you don't know what you're missing. And if you suddenly overload your diet with fiber when you've been on a low fiber diet, you might not like how that feels either. So it's kind of a
Right.
it's a tricky topic for people. And I think there's Dr. Robert Lustig, who was a keynote speaker at the conference that we
Mhm.
were at. He has
Yes.
this product he's developing that's just a fiber that you can dump on like any ultra processed food. And, again, this is not a ideal conversation. This is not like a what's optimal and what would be the best thing ever for the whole planet, right? This is a how do we baby step people towards better? And they've found in their research that just by dumping this fiber onto a processed food, it dramatically lowers the glycemic response of that
Mhm.
food, which means your body is going to be storing less fat and also feeling more satisfied for longer. So it's almost like a experiment, this product, in showing what a pivotal role fiber can play. And of course, once you get someone accustomed to that, now you could walk them closer to grab an apple instead of an apple strudel, grab a real bowl of oatmeal with some nuts on top instead of like a bagel or something. Like grab something more wholesome. But I do think, like to your point, convenience is important because I say this a lot. I am a very passionate health and wellness advocate who has worked as a professional chef. I have been trained in kitchens. I can easily cook a meal for 30 people. I like to cook. I love local ingredients. there are still some nights where I feel overwhelmed by having to make dinner, where I'm tired and it's been a long day and my kids have activities and we're rushing around. There are still nights that I'm reaching for a convenient option. Like once in a while, you're grabbing the rotisserie chicken or whatever your equivalent of that is. And so we do have to have this like reasonable framework, right? When we're approaching patients, we have to meet them literally where they are. And if that's at Kroger in the prepared food section, then that's where it has to be. And we have to be able to guide them towards the better than currently option, not the ideal option.
Yes, and even checking our own bias and privilege at the door because we're working with patients again from all walks of life. And so I may say, I have my Vitamix at home, so I'm able to do all of these different things. But I may have a patient who's like, a Vita what? Like, they may not even have access to a blender. So what can we get them to do? I may have a patient who he's like, Doc, I'm not giving up my dessert. Okay, what dessert do you like? Okay, you like a bowl of ice cream, 3 scoops, all this chocolate, no fruit inside, no nuts. How can we make some changes? So, could we get some frozen bananas, chop those up, dip them in some chocolate, real chocolate? Okay, cut up some strawberries and throw a little nuts on there. Okay, so that is better, and you're still getting that frozen, tasty treat as opposed to this super, well, we'll use proper terms, ultra processed ice cream that is like, is there actually like dairy in here? What's
Right.
in this?
It's like whipped
A bunch
corn
of fillers.
syrup.
That's what it is.
Yeah.
And unnatural ingredients, additives, artificial colors, and flavoring.
Okay, so speaking of food and cooking, you are passionate about food as medicine. I am very curious to hear what role food plays in your life and how you enjoy interacting with food.
Oh, food is major. And so I transitioned to being plant-based back in May of 2020. And everyone knew that I was the restaurant queen, no matter where I've lived. Jay, where are we going out to eat? Patients, family, friends, even strangers. I'm like, oh, what type of food do you like? Okay, you're going on a trip. Let me look up what I have here. Even if I haven't been there, I've read reviews. But I like to try new places, not just chains, but supporting local mom and pop places as well. But when I started transitioning, at first it was difficult because people were like, "Oh, where are we going to eat?" Like it's got to be vegan. Or they say, "Oh, let's go to this restaurant." I say, "Oh, do they have something I can eat?" "Oh, yeah, they had a salad." I look up, it's like an iceberg salad with ranch, and I'm thinking, surely they have more. But I do feel a lot of chefs across America, and the Culinary Institute of America has been helping with that, have really become better at giving us options, not just a clear salad, but being very unique in the way that they develop their side dishes and being gracious and helping us like pick different things and not necessarily giving us a surcharge on the bill. So I've been appreciative of that. But I will say that when I made my changes, it kind of was like all at once. And some people may think that that's the best way to do it. But I do think for others, baby steps may be better because I just out of nowhere like cut all these things out of I hate the word diet, but my diet or my nutrition. And then I did try a lot of different processed vegan foods. And I'm not saying that I don't eat any of those now, but those are not the bulk of my nutrition. It really helped me get in the kitchen and realize, okay, this is what I used to like my mom making when we were growing up. How can I make it different? And not just in terms of taking out animal products, but maybe added oils or not just taking things out, but what can I add into it to increase the flavor profile, to increase the nutritional content. Well, it's
Yeah.
been a journey. I'm still on it, like I tell patients.
Yeah. So for someone who really wants to, try a new recipe, but they feel intimidated and overwhelmed, do you have any tips or tricks? Because, like you said, you made that big change all at once. And I think I've heard a lot of people, they'll say to me, I can't cook. And I'm like, tell me how you know. And they say, oh, because every recipe I try fails. And I always tell them, recipes are terrible. That's my personal experience.
Mhm.
I know how to cook, so when I look at a recipe, I immediately go, "Oh, that's wrong. That's wrong. That's wrong." But that's
Mhm.
a real privilege that I have from more than a decade of
Mhm.
experience in the kitchen. The average person, they look at a recipe, they think this must be true. They try it, it flops, and they blame themselves. So, I would love to hear from you. Have you had any famous kitchen flops, and what did you learn, and how did you take that learning forward into your kitchen successes?
I've had a lot of flops. I'll try things all the time. I'll try to make my own rendition of it. It may be successful, it may not. I'm also coming from a standpoint of where a lot of my foods were more salty from the people who were cooking things for me, or they had ingredients that I don't want to use now. They had much more saturated fat content than I would like to put in my body now. So trying to figure out those changes. And I like to eat all different types of foods. Like if someone's like, "Oh, where are we going to eat? Where would you like to go?" I'm likely not going to choose an American grill type place because I like all different types of food. I'm not going to say I don't like a burger, but I do like to try foods from the Caribbean, Asian fusion, etc. So I'll try something. I realize, ooh, that didn't work. What could I do different? But sometimes I do get down on myself and I'm like, forget it. I'm not going to try anything new. I'm just going to stick to what I know, or I'm just going to go grab something at the restaurant or drive through. But you have to realize just with anything in life, if it's not something that comes naturally for you or something that you're trying to make a change from the norm from those around you, that it may not always be easy. So take a class and take somebody with you, or just don't give up. One of the greatest chefs in America, Julia Child, said that no one's born being like this. You're going to learn by doing. And I'm paraphrasing what she said, but it's true. And so we met at that conference, and I've enjoyed all of the different classes that I've taken, and trying to figure out how to be better at serving nutritious foods to myself and my family, and helping my patients do it as well.
That's awesome. And I'm sure your patients are grateful, but I hope they know how lucky they are to have a doctor who is experimenting along with them because I do think that when you're trying something new and doing something that makes you feel vulnerable, it really helps to have that vulnerability buddy. And of course, food is so personal, right? I think that's part of the reason that this food as medicine conversation is both gaining so much traction because everyone eats and everyone can relate and see how impactful this could be, but it's also one of the biggest things standing in the way of easy mass adaptation and acceptance, which is that food is personal. There are so many different ways to eat. I loved the presentation at the Culinary Medicine Conference from the Food Ways people who are talking about, all these different traditional diets. Like you mentioned earlier, Mediterranean is one traditional diet, but there are many traditional diets, and it doesn't have to be one culture or another. It's just how do we look back and see the many ways that many people around the globe have consumed, fruits, seeds, nuts, plants, whole grains, moderate animal protein, tiny amounts of oils. Like there's a very classic palette of wholesome ingredients that you can find across cultures. And if you're ever back in the DC area, I hope that you'll come and get some Ethiopian food with me because my favorite.
Oh, when? I'll actually be back in a couple weeks.
Oh, perfect. Well, hit me up because we have the best
Yes.
Ethiopian in DC, and it's an incredible way to have a fully plant-based meal that is spicy and
Yes.
flavorful and so filling. And there's fermented foods in there, and it's microbiome friendly and gut friendly and high fiber. And Ethiopian is just, it's got my
So
vote.
good.
So good. So good.
Yeah. I will say I grew up watching the Food Network, right? And one of my favorite chefs to watch was Sandra Lee. So Semi Homemade with Sandra Lee. So again, for some of my patients or even myself or friends, family who like, I'm not a good cooker, I don't like to cook. Like, well, are some of the items in a recipe or a dish that you've seen or want to create off of social media, like Instagram, Pinterest, TikTok, etc.? Could some of these items already be like pre-chopped or pre-prepared? And we do want to watch the plastic, I know, from an environmental friendly standpoint and even just from our health standpoint. But what can you do to kind of cut down on the time if you're saying that's an issue for you, or you don't have the knife skills or different things? What can we do to kind of help speed you through the process? So each patient is like a new opportunity to learn something and figure out what can we do here and how can I take that information off to help somebody else, including myself.
Yeah, absolutely. The other night I made this big pot of lentil soup. And I love to
Mm.
make lentil soup because it's delicious and my kids actually really like it. And it's so easy because lentils are so small, so they cook very quickly. So
Mhm.
in an hour, you can have this giant pot of lentil vegetable soup that everyone can enjoy. But if you read many lentil soup recipes, they call for a tablespoon or so of tomato paste. Tomato paste is so annoying. It comes in this stupid little tiny can. The can opener doesn't want to open it. You're struggling with it, you're fighting with it. You take one scoop of it, And then you have this stupid can in your fridge for the next month. Eventually, it gets mold on it. You throw it away, and you've wasted 85% of your tomato paste. But you
Mhm.
had to do it for that one soup. So I was going to make this soup, and I'm looking at this stupid can of tomato paste. And I look in my fridge, and I have organic tomato ketchup. And I'm like,
Mm,
okay, ingredients: tomato paste, vinegar, spices. A lot of lentil soups, you add like a hit of vinegar or lemon juice to give it a little acid towards the end, right? So I'm like, all right, tomato paste, spice. A lot of things are fine if you add just a pinch of sugar. It just like sort of balances the flavor. I'm like,
right.
why am I going to open this tomato paste when I could just squirt this ketchup into this soup? So I did. I had my onions and my garlic cooking and my herbs, and I just threw some ketchup in there. And then I continued on as if nothing different had happened. It was a delicious lentil soup. No one has to know that I used a squirt of ketchup instead of fighting with this tomato paste can, but that's one of those things that a person who doesn't usually cook, they feel beholden to the recipe. That's like, I have to follow this recipe. I can't mess it up. And I think you got to stay flexible in the kitchen. You got to be willing to go, you know what? Ketchup is basically tomato paste and whatever. Let's give it a shot. So often, giving it a shot will totally free your mind and help you make lentil soup with much less stress.
Yes, that's good. Or on the contrary, we have people who are like, I know how to cook. I know I'm supposed to eat healthy, but it's not happening. So if you know that you know how to cook, but these are foods that I'm absolutely not going to eat, Dr. Gordon, or I've had that dish, so I don't like this particular vegetable. It's like, have you tried it a different way? So it's really getting people to step back and say, do I need to actually go buy that? Or am I really saying that I'm never going to give that food another chance? Like, how can we just open our minds, our hearts, and our palates to something different that hopefully can help us and those connected to us in the long run for the better?
I love that. How can we open our hearts, our minds, and our palates? That is such an important question. And I want to pivot from that to sort of one final set of questions for you. We have touched on this, but I think it's important when we're talking about how impactful food is in health that we consider the societal structures at play, the policies that are behind our food system that are maybe promoting or not promoting certain foods, that are maybe making some foods more accessible to the detriment of people's overall health. So when the average citizen hears the term public health, they might think masks and vaccines and hand washing and all those things are great, but they might not necessarily realize how critical nutrition is to public health and to disease resilience and to chronic disease management and prevention. So I would love to hear your thoughts on the role of the public health system and policy in promoting and sustaining a future where food is medicine.
Yes, so I think it takes first looking within our own self and our family. What are the needs that we have? Voicing those needs to elected officials in our communities, making sure that we're voting in all elections. There's all this hype right now about the upcoming presidential election. And some people, that's all they're focused on. They may not even click a spot for any other position that's on their ballot, but do realize that just like in healthcare, right? It's not just the physician, the nurse practitioners, the nurses, the surgical techs, the scrub tech, et cetera. It's everybody working together, including the patient, who I always say is the most important person on the healthcare team. Same thing in society. It's not just the president, it's Congress, it's the judges, right? It's your local mayor, it's your representatives, it's your city council, et cetera. Everybody working together to create policies that affect your well-being. So I used to think I'm going to be a doctor, I'm going to help people, I'm going to give them this information that I have. Oh, they bring me a problem, I'm going to help them solve it. Not realizing that my influence is literally like 10, maybe in a perfect place, which doesn't exist, 20%. The rest of the factors that affect a patient are majorly influenced by those who we elect. So again, voting in all elections, and not just voting, but voicing your concerns to these individuals. And you may say, well, it's not going to make a difference. Well, the changes that we see today may have taken decades to go into effect. And so maybe it won't help you. You may not see in your lifetime, but what about your children or their children and their children? So we have to make sure that we do that. If we didn't, we wouldn't have, for instance, here in Indianapolis, Marion County, we have fresh bucks. So where individuals can take those, they can, depending on what their income is, they can get fresh produce and they can actually get a discount on it or get two for the price of one. So we wouldn't have that if people weren't voicing their concerns and if we didn't have experts who were putting their voices in as well, saying how important it is for individuals to get nutritious foods and how that can help us on the back end with decrease in healthcare expenditure. So I do think there are changes that are occurring. We definitely have a ways to go, but the more we can speak out about it, the better. And we also know that we need more of us involved in research. So not just in the exam room, but also out here working with the community to get people to get involved in these studies so we see how it affects everyone and just not traditionally who has been a part of these studies, which are Caucasian males, right? Like women, we weren't involved, minorities weren't involved. And there's a lot of stigma that comes along with that, with things that have been experienced in the past for certain sects of the population, racism, oppression, etc. But the more vocal we are, the better. And it can be hard sometimes when you're out here shouting in a megaphone and people are like, "Who are you? Like, be quiet." But I'll be that person, Marian. I'll just keep speaking up, and it may push some people away, but I think it's won a lot more.
Well, I appreciate it. And I know that so many other people do too. And I love how you said, we all have a voice, we all have a vote, and we all eat. So every single day, at least 3 times a day, we have an opportunity to vote with our palate, with our dollar, with our fork and our knife. And, once every couple years, we have other opportunities to vote on seemingly very impactful times and day to day, we have a chance to vote with our actions in our communities as citizens, as community members, as members of organizations or religious groups. We all can support each other and promote health and well being in our communities. So I really love how you said that. It was a beautiful call to a very complex action, but I'm with you all the way.
Right. And I think another way, especially in our community, is voicing concerns to local health systems. So you're seeing a lot more of people collaborating and not just making changes in policies and strategic initiatives based off what they think will work for people, but bringing people in, having community participatory conversations where you're saying, what do you need? What would make you more apt to come into our office or to support our business? So we have one of the largest healthcare systems here in Indianapolis, which just opened a clinic on the east side of Indianapolis, where my church is, that I've been a member of since I was 4 years old, where my grandmother has lived for over a decade now. And they have a major healthcare facility, beautiful. The public health department is actually on site also. They have art fixtures for patients to look at because we know that art is good for our well-being. They have an outdoor garden where herbs are grown, crops are grown, which are then used in their teaching kitchen where patients are brought in. And I was able to speak with a patient who had diabetes and has got his blood sugar down. And it's been down for many years now. He's not a patient at that clinic. He came to the opening, but was a patient of one of the other clinics in the city. And he said working with the nutritionist in her program and being in these classes, learning like what to prepare and how what he was choosing, not to point fingers again, to say, wow, I had no idea how that was affecting my health and how now I don't have to take as much medicine as I had to take before. Or, I knew exercise was important, but I don't like running, but I didn't realize there were other ways that I could move my body. So having these open and honest conversations with each other can really help make a difference. So now you have kids in that community where my grandmother lives and where I attend church who are saying, wow, that's a place where I can go to get help instead of, well, don't go there. Those doctors, they don't really want to help you. All they want to do is get your money. I mean, this is what we have to do. And it's not that this has never been done. I mean, irregardless of what your political affiliation is, what your religious background is, what your racial ethnic background is, we as Americans do have a history, even if it was in small areas of the country, working together despite differences. Because you may not think that it affects you and your dollar, but trust me, it does. That individual in that community across town not having access to a fresh banana will affect you, if nothing else, for it being a blight in your community. So think about others.
Absolutely. And on that note, that was so beautifully stated. So I really just want to thank you so much for joining me
Mhm.
today in this conversation because I think that we've touched on critical issues in public health
Mhm.
and also highlighted the amazing work that you're doing. So I want to say thank you for speaking with me and also thank you for being a voice and a presence and an advocate and a doctor in your community and for sharing your knowledge as a health communicator because it's so important and we just need so many amazing people like you to keep doing this work. So thank you so much for doing it.
Oh, thank you, Marian. I'm so glad that we met at the Health Means Food conference. And I can't wait to try that Ethiopian food in
Yes.
DC.
Call me. Call me when you're in DC.
I will.
Thank you once again for listening to the Marian Flaxman Network Podcast, a podcast dedicated to reintroducing personal narratives into critical public health topics. For more information on me, Marian, please visit my website at marianflaxman.com. For more information on my guest, Dr. Janel Gordon, and her work with Wish TV, please find the links in the show notes. This episode was produced by Brain Trust Productions and sponsored by Informed Solutions Consulting. Thank you so much once again for listening, and we will see you next time.